So next we've got Emiline Sundman, who is a PhD candidate graduating this summer from the University of Iowa. She has worked with horses and swine, but this presentation is going to be about cattle. So she'll be describing for you the behavioral language of the chronic pen. And if you don't know what a chronic pen is, you're going to learn very quickly.
Yes, thank you so much for the introduction, and thanks so much for the invitation to talk here today. To basically introduce everything, so let's get started. So for those of you who may not be familiar with feedlot cattle production, I want to kind of set up two different things. The first is how we may define different types of impaired animals in a feedlot. So we can use the word impaired to have this broad umbrella term to mean anyone that is compromised or diminished in function compared to your healthy animal. And that may mean they are sick, they are injured, or any kind of variation of those. We then may split our impaired animals into two subcategories of acute impairment and chronic impairment. And your acutely impaired animals are going to have your short, more often severe conditions that will resolve in a matter of days or weeks. And they are typically treated in a home pen, so treated in return home, or they may be pulled to a hospital pen for a shorter term stay. And then you have your chronically impaired individuals on the other side, which are those with more long-term conditions that may last weeks or months. They are the ones that are going to be pulled into a chronic pen, and reasons for this may be because of failure to respond to the initial treatment events or just needing additional recovery time beyond what they have been given. And so this leads into our hospital and chronic pens. And the reason we will pull these animals into these specialized pens is because we recognize that impaired individuals have unique needs compared to our healthy populations. And our home pens are developed for healthy populations. And oftentimes we will talk about sickness behavior in particular for these impaired individuals, because we know that their unique needs are stemming from their unique sickness behaviors that they express. And often these are considered a highly organized strategy that at times can be critical to the survival of that animal. They're helping them along in the recovery process. And in feedlot cattle, most of our impairments are going to be related with bovine respiratory disease, or BRD. And so I've just given you a little subset of the literature about what we would expect for bovine respiratory disease cattle in terms of sickness behavior, which is going to be decreases in activity, feeding, rumination, and grooming, decreasing in lying bouts, and increasing in lying duration. And so what our hospital and chronic pens do is they allow us to provide this unique population with specialized resources and specialized management to really help support them during this recovery process. And it is a really unique population because if you think about it, everyone in there has something going on. And so can we kind of think about how the different types of impairment and the different stages of impairment are being expressed behaviorally in this unique population compared to other home pens or studies? And so that's kind of like the first question that we're looking at is, for this population, what are their behavioral needs and the behavioral expression that we would expect to see in this pen? And then, of course, it's really important to touch on the welfare of this unique population, because we know that when an animal is in an impaired state, it is going to have an impaired or negative valence of welfare. If we evaluate that from a scale of poor to good, they are going to be towards the poorer side because of the impairment to biological functioning and the potential negative affected states that they are experiencing during this impairment process. And so when we manage an animal in a specialty pen, it really provides us with an opportunity to recognize that they are impaired and then to provide additional support to prevent that impairment from getting worse and to do our best to really support them during that convalescence and recovery period. And in our chronic pens, the most common outcomes are going to be either recovery or mortality, because you have this really high risk population that hasn't responded already to normal treatment. And so there are clear welfare differences between those populations we need to be keeping our eye on. And one of them would be the presence of timely interventions for animals that are not recovering, such as euthanasia. And this is an important audit criteria in a lot of our feedlot audits. And so what matrices can we use to identify if you are recovering or if you are not? And that's where our behavior is starting to come in. And so the objectives of these study were first to identify if cattle that enter the chronic pen, so at their entry, have behavioral differences that may be associated with their eventual outcome, recovery versus mortality. And then focusing in on that certain subpopulation of the mortality individuals that have potential risk of mortality, can we describe how when they enter the pen versus before their mortality event, what are the actual changes in behavior that are seeing that can help us identify as they progress towards mortality? And so some of the methods, the feedlot in this study was a roughly 2,400 head commercial feedlot in Iowa that we enrolled from August 2022 to March 2023. And this is a small to medium sized feedlot for the area that we are in. Their chronic pen is a 90% chronic pen, but they may occasionally throw in the acutely impaired animal because of the smaller size of their feedlot. They're often managing animals together. And the additional resources they provide are a hay bale and corn stalk bedding. And then the animals enrolled were a convenience sample. We did not influence the feedlot at all of their choices of putting animals into the chronic pen. We just enrolled anybody that came in while we were out there. And they only have heifers at this feedlot. So that was a restriction based on the commercial feedlot. In terms of the photos and analyses, so I mentioned the entry and the exit. So those are defined as the first and last 48 hours that the animal was in the chronic pen. And our photos were taken with 15-minute instantaneous samples of 3 trail cameras placed around the pen to capture the whole pen. And you can see that the animals were individually marked with hip tags to aid in that unique animal identification. And the results I'm presenting today are preliminary and using non-parametric analyses only. And so for that first objective, looking at entry between recovery and mortality animals, we use Mann-Whitney U tests on a subset of 39 individuals. And for the objective 2, looking at the overtime entry versus exit in mortality individuals, we use Wilcoxon-Sign rank on 12 individuals that had behavior for both of those phases. In terms of our ethogram, so we have 3 different groups. We first analyzed whether the animal was standing or lying, so pretty basic. And then on top of that, we added were they standing or lying at the bunk or at the hay, the 2 interesting resources in this pen related to feeding behavior. And then we also looked at their isolation status, so whether they were near other individuals in the pen while standing or while lying. We had 2 observers trained to collect this behavioral data, and they had to reach a 90% agreement calculated by an index of concordance before they were allowed to collect data. And reliability was regularly reassessed via repeated clips for that intro reliability, and then spot checks with each other and a reference observer, myself, throughout the study. The observers were blinded to animal diagnosis and outcome, but we could not blind them to date and time. 1, because trail cameras have photo stamps on them, and 2, because of the 15-minute intervals, it's really hard in one frame to be like, where is this animal that I'm looking at? So we needed to use the chronological progression of those clips to really be able to accurately identify our focal animal. So getting into our results, that first objective, entry behaviors, and whether they eventually recovered or had a mortality event. The proportion of scans spent standing and lying were not significant, and the proportion of scans spent standing at the bunk were not significant. But for the 2 that were, to set you up on these graphs, you have on your x-axis your recovery versus mortality groups, and on your y-axis you have the ranked scores, since this is a non-parametric test, where a higher rank indicates they did that behavior more often. And you can see that on one side, your left, the stand bunk had a higher proportion of the eventual recovery animals spending time at the bunk at entry compared to the eventual mortality. And then flipping that for isolation, where those that eventually had a mortality event did spend more time isolated than the recoveries. For objective 2, focusing in on those mortality animals over time, this graph is set up with a null value of 0 would mean that there was no difference between entry and exit phase. And then on the axis, the difference is kind of above 0. Like these ones show that that behavior is more at entry than exit. So it was a subtraction between those 2, and then comparing whether those differences were significantly different, 0. And you can see that for the animals that had mortality events, they spent more time standing at the bunk when they entered the pen versus when they exited, and they spent more time standing at the hay at that time period as well. And then flipping that for the exit phase, that's when they spent more time lying. So you can see it's a negative value below the null value. And then isolation was just a trend at 0.08, and for having more isolation at that exit phase. And so this is a brief summary, and I just want to point your attention to the highlighted ones in purple, because those were the behaviors that we saw. We could tell significant differences in both of our research questions, suggesting that perhaps that might be where we want to focus a more in-depth behavioral analysis, that standing at the bunk and that isolation behavior. I also am interested in not just like whether they are doing this behavior, but are there certain more subtle behavioral patterns that can really tell you a little bit more, such as are they visiting the bunk during high and low activity periods when the rest of the pen is doing it, or are they kind of asynchronous in their bunk visits? This study is kind of the first ones looking in this unique chronic pen. And so it's really nice to see that our classic behavioral signs of sickness are being visible in this pen where animals are all sick. So usually it's healthy versus sick. You see decreases or increases in these behaviors, but even within a pen when everyone is sick, you can still kind of tease out some behavioral differences that might have important indications. Some of the limitations, so it's kind of a pilot study, one feedlot with one sample, and we have plans to do this again at another feedlot. And of course, scan sampling has its disadvantages and advantages as well, with that 15-minute interval being relatively long for more rare behaviors like standing at the water, which I didn't present here. The future work, so again, this was a preliminary subset. We're planning to do parametric modeling of all the animals and to add some latency data as well as time budgets. So overall, how are they spending their time? And we do have a collaborative project plan with Agriculture and Agri-Food Canada and Dr. Karen Schwartzkopf-Jenswein's group to look at live video, so continuous in a larger Alberta feedlot. Ultimately, with the goal of kind of translating this behavior results and other epidemiology and welfare assessment work that we are doing into extension materials to help producers make these difficult decisions in their chronic pens, figuring out how to best manage and make decisions for the welfare of these animals. And I just quickly like to thank financial support from the USDA and NIFA, the participating feedlot for letting us into their pen, and the students who helped collect data. And I'll take any questions.